here, as you can see with this first poll, in deciding who's on the call and getting a view of that, of who the system of care partners are representing on the webinar today. And I'm really excited because there's a lot of different folks on the call from what I'm seeing, and that's fabulous. I love to see that there is also family and youth representation. Thank you very much. Very important for this. And so we're going to have this poll, and then in just a minute I'm going to ask Adam to pull up our second poll. This one in particular that you're looking at right now is about the representation of the partner agencies and entities and beings that are within a system of care. And obviously I couldn't put them all up there, but I tried to capture them as best you could. Some of you all may be sitting at a computer in your own office space or in your own space, but some of you also may be in groups in a room. And if that's the case, please feel free to check all of the folks that are in there. So if you have, you know, a family member, a youth member, and somebody from the religious community, please feel free to check all of the boxes of those folks in there. We do realize that some of these are not going to show up as non-duplicative, but we wanted to make sure that we get the breadth and depth of folks that are participating today. So my name is Carrie Collins, and I'm working with Reclaiming Futures as a national coach to some sites in developing Reclaiming Futures, and also as a consultant. But I've also had a long history with system of care. I'm with Kentucky. We had a grant, one of the originals way back with system of care with the CASP grants, the early childhood, the early grants in the early stages of system of care. And then we had, the first grant that we had in Kentucky was actually with a school system in southeast Kentucky. And so I've had a lot of work and history with that also. And as we were doing that, a lot of the things that we've been working on has been system improvement, process improvement. You can't go into work within the system of care with the idea that everything's perfect. And so if everything is not perfect, then how do we change it? How do we do it in a way that's most effective, most cost-effective, gets the best outcomes for the people that we serve? And that's really what this Plan, Do, Study, Act, the rapid cycle testing that we're going to be talking about today is really all about. So Adam, if you and Care put up the second poll. And so this poll here that I'm asking you to do, and I just really wanted to get a sense of who's out there, this one really is more about the role, what role you're representing today on this webinar. And once again, you may be wearing two hats, you may have several people in the room, so just pick whichever feels the best to you with this. And as you're kind of working on that, I'm just going to go ahead a little bit in the presentation here and let you see here that one of the things that I wanted to talk about was that when we get started on implementation of rapid cycle testing, it's important to know that a lot of this work is credited to a fellow by the name of Dr. Edward Deming, who started off as, believe it or not, an electrical engineer in the 1940s, and then later specialized in mathematical physics, which kind of seems far away from human services, but really not so much. So why are we looking at these engineers and what they bring to the table? One of the things that we have learned over the years is that good leadership is always open to looking at leaders in other fields and seeing what their successes are and figuring out how we might translate those successes into our own field. And in this case, of course, it's human services. Deming was a system thinker, which goes quite well with this. He reminded us that every system is perfectly designed to get the results that we get. So if the results are bad, then we have to actually take a look at the design of our system. Deming also told us that in order to improve, we have to make changes, but simply making changes doesn't guarantee that improvement will happen. So just changing to change is not going to guarantee that it's going to get better. Deming addressed a lot of quality improvement. We often hear that we're working so hard or we're trying our best, but just trying harder is really the worst quality improvement plan of all. So if all we're doing is creating more work for ourselves, that's not going to be guaranteeing at all that we're going to get better results. A fellow by the name of Dr. Walter Schuhart actually developed a thing called the Schuhart cycle, which evolved into the PDSA, or the Plan, Do, Study, Act, that we're going to be talking about today. Deming was not a real big fan of the evolution from the Schuhart cycle to the PDSA, but in the end, he pretty much owned it. He actually wrote about it in some 1990 work that he did right before he passed away. So we'll be talking about this PDSA today. Rapid cycle testing is simply a process improvement that's recognized across fields of manufacturing. So rapid cycle testing is not just what we're talking about today, but it's been adopted, embraced, and adapted for manufacturing, hospitals and the medical community, education in classrooms, and now into the human services. And we've seen this particularly, and some of you all probably know about this quite well, in the work being done by the University of Wisconsin around NIATEX. Can we take a look a little bit at the polls? Cora, do you have any comments on what we've seen here so far?
Well, looks like we have provider of services and quality assurance, quality improvement people. Then we also have some grant administrator, implementers, and state, local government agency employees, evaluator, researcher, and then some others like me.
Okay, great.
Yeah.
Thank you. Thank you. And once again, like I said, as we're going through these, if you're wearing two hats or there's other people in the room, please feel free to make sure you collect all that information. So let me move on here. I'm going to talk a little bit about and get us ready, kind of moving forward into the actual how do you do rapid cycle testing and Plan, Do, Study, Act. This first slide here is about improving the results by improving what we do. In other words, when we talk about process improvement, we're talking about what we do. It's a series of actions that lead to a result. If you really want to achieve good results, then you have to really start with a well-defined process. You might not have to dig too deep in order to figure out what needs to be changed when you're looking at your process. Oftentimes, and this is not unusual, the answer is as simple as making sure that how to do the process is clearly and simply defined. Many times people are trained to do things via word of mouth or on-the-job shadowing, which a lot can be lost in translation. Sometimes we just assume that someone knows what we expect. So if we want to improve the outcomes, the final results of what we see, we have to improve what we do. We have to improve the process. What we've found and some of the research and some of the stuff that Deming said actually had this up to 95%, that approximately 85% of the problems we have with quality, when we look at the quality concerns that we have with what we do, is actually traced back to the doing. It's actually traced back to the process, not to an inanimate object that isn't working well. So when we look at quality improvement and quality assurance, and I'm glad there's some folks on here for this because I wanted to tie this in, because really what we're talking about is a process that can be used within your quality improvement and quality assurance work. Quality improvement is the continuous quality process improvement. Quality improvement is what our focus will be today when we look at Plan, Do, Study, Act, or the PDSA steps. within rapid cycle testing. To know that we've achieved and maintained our quality improvements or process improvements, we use the quality assurance. And that helps us measure the level of compliance of what we're doing. Quality improvements, in other words, is improving our processes and ultimately our system. And quality assurance is measuring compliance with doing things right. Quality assurance normally focuses on the individual's performance. So here on slide 7, what Debbie was talking about here is that quality never really ends. There's a never-ending cycle of continuous quality or process or doing improvement. Our work every day is about doing something. It's a process. We can never assume that we no longer need to improve. These never-ending cycles of improvement are in 2 different things here: rapid cycle testing, which is a method of improving what we do in order to achieve better results. In other words, we replace what's broken with what works. The Plan, Do, Study, Act describes the steps within the process. Adam, can you put up poll number 3? This question will actually help us get a better understanding of your experiences with these processes. I know that some of you all are with quality assurance and quality improvement. And just check all of them that apply to you. Just wait a minute to see how that works. While you're finishing that poll, I'm going to go on to just talk a little bit about how to prepare for rapid cycle testing. There's some legwork, some work that you need to do before you even get into the actual testing. One of these is that there are, the first thing you need to know is what's not working. You need to know why it's not working. Your agency or your leadership team, you may have an advisory team that's already out there. You may have a leadership group that's already out there that sees kind of the big picture and the overview of your agency or organization and knows what's working and what's not working very well. These are the folks that need to get together and kind of look at these questions and figure out how to answer them. So when they take a look at what's not working in their agency and how do they know what's working, they're really looking at formulating a target or an aim of what they want to improve and looking at data as far as informing them about why something isn't working. Your agency team needs to review both anecdotal and hard data and let it drive the development of the list of potential targets or aims of what's not working in your agency or setting. These folks will make a list and probably already have a list somewhere of concerns that they have of things that aren't working. This is often done through continuous quality improvement processes or committees that are already set up within organizations. The members of these groups need to have a pulse on the everyday work that's being done by the folks that are actually on the ground doing the work, and they need to choose the target or aim of rapid cycle tests. So that's kind of the beginning piece of the leadership role in this. The second part of it is that they need to be discussing what a team would look like to see the outcome of the improvement of the work. So what would it look like? They need to write their expectations of the outcomes in a measurable way. It's the only way to know that you really succeeded. So when they start looking at not only the target and the aim, and they look at what kind of data they can bring together, they need to be talking about, so what would it look like if it was working? So here's a visual of what rapid cycle testing really looks like in using the steps for the PDSA or the Plan, Do, Study, Act. by starting by identifying the target or aim, and that's at the top there. You've already done that. What is it that you want to see improved? There are these are broader statements like, for instance, improve participation, improve attendance, increase involvement, increase satisfaction, those kinds of statements. The next thing is you describe in measurable terms that the outcome or final result of the improvement will look like. That leads then to choosing from the list of strategies just one. You can only choose one of the changes in the process that you're going to be working on at a time. Do you all remember when you were in school science courses, you'd have these experiments to do, and if you changed several things in your experiment at the same time and there was a successful outcome, you couldn't really describe why it worked. You knew that something within those changes that you did caused success, but you just didn't know why. So was it a combination of all three things you did, maybe two of the three, or maybe it was just one of those things that maybe changed the outcome for it to be positive? It's important to know exactly what works and what doesn't work. Otherwise, you're wasting a lot of time and effort for folks that are working. Then you see at the PDSA cycles that begin after you do those three things. And across the bottom of this particular slide, you see 3 cycles. In actuality, there may be only one cycle, or they may be a whole lot of cycles that you end up going through. And you'll see that as we kind of walk through these a little bit more. Cora, is there anything you want to share with that last poll?
No, I think that if memory serves, it looks like most people don't. While some people do have experience with different forms of rapid cycle testing or NIATEX, most people do not. And then it looks like Mina also asked if you would repeat the examples of targets, aims.
You see examples of the target aims. On another slide here, or just at the top?
I think just at the top when you sort of gave examples of what
sure.
those might be, if you would repeat that.
Sure, yeah. And I'll get into these a little bit more so you'll have real specifics here. But when you're formulating your target or your aim for improvement, that's your broader goal statement. That's your broader vision of what you want to have happening. So for instance, it could be something like you want to improve participation of family members in treatment planning. That's your target. That's what you want to see. When you get down into describing your outcomes in the bottom here, your outcomes would actually say, we want to increase it by 25% or have, 5 more members attending every week, those kinds of things. And then as you brainstorm, what kinds of changes, what kinds of strategies you could use, that's where that comes in. You think about all of the things that you might do to actually increase the number of participants of family members in that particular target or aim. Does that make sense? Any other questions of that? Good to go. Just write in if it's not. So this next slide is about the PDSA change teams. So, you had those teams that I was talking about before. There were more of the leadership teams. There were managers. There were people who had big picture thinkers. They may be actually teams that, interagency community teams that you have working together that would help you kind of see a big picture thinking of what kinds of things they're having difficulty in within the system. In this, we're talking about actual change teams. And what we know from quality assurance and quality improvement is that really all staff should be bought into this. There shouldn't just be a staff person that's designated as a quality improvement staff person. Everybody in the agency, organization, entity, group should be involved with making things better. So this slide in particular is talking about that process improvement is something that all staff and team members or system partners should be involved with. They need to be engaged and supported in identifying what isn't working as well as what is. So when choosing a team for a particular rapid cycle test, you should have representation of those folks that will be most affected by the change. So in other words, you don't have this one change team that does this, that addresses every kind of cycle, rapid cycle change that you need to have, because not everybody is affected by that. And you need to have those people who are closest to it that can help understand when things have actually changed for the better and have ideas about how to do that. The other thing, and most importantly, and I can't stress this enough, is you must get buy-in from leadership, whether it's CEOs, administrators, managers, supervisors, team leaders. It takes committed management and leadership for change to actually occur. So who should be on a rapid cycle change team? These are just kinds of guides. They're not laws by any means. So the first is a rule of thumb, once again, not a law, is that you should have no more than 9 participants. One reason is because tables don't usually hold more than that. But the other one is because, as you all, I'm sure, know, that the more people you get working on a particular item of change, the more difficult it is when you start getting a room full of people with lots of different ideas. But this process is really about pulling out ideas, so don't be afraid of having a larger group. A smaller team of 5 or 7 seems to be the most effective in my experience, but you also want to have the right representation of your team, so don't limit it if you are leaving people off that are critical to be there. You should look to having a role representation and not just titles, job titles sitting at the table. So you want to be looking at membership roles. You need someone from leadership, or if they can't make it, you have to have somebody there that the leadership listens to. And just as importantly, the person that comes to the table needs to be seen by the other team members as being a credible representation of the leadership. You need to have a process expert, someone that is a really great facilitator and knows the change process. You can look to them to be the leader of the change team. Every change team needs to have a leader or a facilitator. You need to have someone who is a content expert. These people will be your champions for doing things right. They know what the turmoil and frustration feels like when trying to implement this process that hasn't been working. It's good to have a representation from different areas that are affected by the change that you're proposing. For example, representation from, for instance, billing staff, treatment staff, family members, or maybe even other agencies. So you need to be thinking kind of broader when you think about who's going to be impacted by a change. You need to have significant number of folks there. I use the 1/3 rule of thumb that have what I call fresh eyes. These are people that aren't so jaded in dealing with the process that they don't believe that change can happen or that it will happen, and they're not stuck in doing something the old way. And you need to have representation from those that are the most impacted by the process. Oftentimes, these are the people that we serve, or they could also be agency partners. There's a question all the time about, having multiple rapid cycle change teams, and I think it's because, we go at this, at least from the beginning, of biting off one thing at a time. But once you get going on it, and it really seems to take hold, and it feels very familiar, and people are comfortable with it, and particularly staff or family members or those in the community get used to being on the teams, it's really probably one of those things that is going to be really helpful to have several teams going at the same time. So when you look at that, if you engage in multiple change teams, then each team would have a specific aim or target and a clearly defined strategy that they're testing. So you wouldn't have these multiple teams all working on the same thing. It's important to keep track of what's going on in each of these different change teams, like tracking things like maybe who the leader is or what the results of each PDSA cycle is, the time frames of when they started the cycle and when they were ending it, maybe what the impact of the process, what the impact of what they're doing is on the process as well as on the system. Those are just some things that you want to keep track of. And there's some examples of some formats out there that can help you do that, keep track of each one of those. The other thing that happens when you start doing multiple change teams is that you may actually have them bleed over into each other. So what you have is these unintended consequences that can happen where you have one group working on a change, maybe in another part of the agency even, and not thinking there's even a connection. But because you've changed maybe the way billing happens or the way intake occurs or the way teams are developed, that then impacts someone else or another part of the agency or another partner agency out there, or your families and your youth that are participating. Adam, can you pull up the survey question number 4? So this survey question says, my agency or entity supports positive system change efforts that are identified by our staff, other agencies, consumers, or the community. Answer this poll in general. I know that there's, it can vary depending on what this is specifically about, but some agencies and entities are more comfortable with having the system change efforts introduced by their own leadership rather than having outside participation. So that's kind of what I'm looking for here, is how comfortable you think your agency or entity is right now. Looks like most are. That's good. Few not. So let's go ahead, and I want to say here before I do that with this poll in particular, this kind of reflects back to your the earlier slide that you have talking about the importance of having the leadership, the CEOs, the leadership's blessing in having change. And so when you start doing these rapid cycle tests or start doing process improvement, whether it's this framework, this model, or something else, really having a good sit-down talk about the comfort level of your leadership in turning this over to staff, turning this over to people who don't normally make those kinds of decisions. That's really what you want to have that question about. And I think those of you that have participated in NIATEX, that's one of the key cornerstones of their work also. So this slide here is just telling you that instead of making random changes, which we all have been guilty of doing, we're going to be following the PDSA roadmap, which is the Plan, Do, Study, Act. So here we go. I'm going to walk you through the Plan, Do, Study, Act here. And this is what your team would be working on. Once again, this is your change team that would be working on this together. So when your team begins planning in the PDSA cycle, you bring forth really that preliminary work that we talked about on slide 9, where you had the leadership get together and give you some guidance and background and oversight. To begin a PDSA cycle, you have to have already identified your aim or target. You can't start the cycle without knowing what it is that you're wanting to change. During the plan, you brainstorm the possible strategies that could lead to your desired outcome. So let's say your outcome you want to have, once again, improved participation of partner agencies coming to meetings. And so if that's going to be your aim to do that, then what you do is you sit down and you just let everybody brainstorm about what the possible ways of getting people there could be. And one of the things you have to do here is to make sure that there's no wrong answers and that nobody's going to be ridiculed for coming up with something. You really want to have people think outside the box and to be as concrete and simple as possible. Sometimes people come up with really complex ideas. We have people in our groups sometimes that like to draw out a complex mathematical theory on the board about how to get this to change. What we have to do is have them back up and talk about within that whole theory, what are the steps, what are the processes that have to happen, and help them break that down to a more measurable rapid cycle test that can occur. Your change team will also have to identify what and where you can find data that will help you determine the baseline level of what's happening now. I really want to stress here that when I talk about data, I'm not just talking about formal data collection of numbers. I'm also talking about stories, and I'm talking about surveys, other things that you do. And I want to really emphasize that what we're talking about with rapid cycle testing oftentimes is not really hard data. And it's simple to come by. And sometimes we've even had this happen where some of the data that's collected is literally tally marks, that somebody sits and answers the phone and puts a tally mark down every time they get a particular call. So it doesn't have to be complex or complicated when we're doing this. Have the team look for data that you can use along the way to see if positive change is actually happening. So that as you're implementing this, you can see that there's some movement one direction or the other. And the data may, look for data that may also help you later when you're maintaining the change or maintaining the progress that's been made. Also in the plan, and I'm going to dig just a little deeper on this data piece, is during this planning stage, you need to ask questions like, what kind of data are you going to use? When are you going to collect the data, and how frequently is it going to be looked at and reported on? Who has access to the data and who can analyze and interpret it? Where is the data kept? These are just a few questions, but these are the kind of the starters, the question starters that help the group start looking at, all the different angles of the collection of the data. Your team also needs to have a plan on how the data is going to be collected through the PDSA cycle or cycles, because there could be several. And what kind of reporting that you're going to use. The reporting can be as simple as meeting minutes. You may have periodic reports from different members. You may have a final summary that you want to have presented to the team and then later on to the leadership. The team will ask the same kinds of questions about the data as they did about the kind of data that you're collecting. They'll want to know what and where and when and who for all of those same things about the data collection. The team's now moving into actually doing, and the PDSA, they're moving into doing the next step. In this step of the cycle, the team starts collecting the baseline data. They begin implementing the change strategy that's been outlined, the very clear, clean, measurable change strategy that they've done. They start collecting the data and documenting how it's working. Your team needs to meet regularly during these cycles to review the progress and sometimes lack thereof. Your team asks things like, is it working as expected? Is it not working at all? And are there some unforeseen consequences to the change? There may have been things that they never even expected. It's really important that if the change just isn't happening, that it's just stale and that nothing is changing, and you realize that, let's say you set up a 4-week change cycle, and by the second week, you're just seeing that it's not going anywhere, or more importantly, that you start seeing negative results happening, the team needs to say stop. And they need to go back to the plan in the PDSA and start over again by choosing a different strategy on their list. So you could always opt out. The next place here on the slide is actually about the study. It's also called sometimes CHECK if you talk to some people, particularly in other fields. I think the medical field uses CHECK more often, Plan Do Check Act. Your team will now study the results of the PDSA and all that data that you've been collecting. So what is the data that you collected and analyzed telling your team? You need to have that conversation. How is the prediction of the final result come true? I mean, has it really done what you expected it to do? What worked and what didn't work? And once again, you have to make sure that you're capturing this information in writing for the team to use. So you may end up having to conduct another PDSA cycle. And if you do that, you want to have history of what you've done. Now we're going into the act. So this is where your team actually has to decide how to act on the PDSA, on the information that they gleaned from doing this cycle of change, process change. So after reviewing and discussing the data, your team has to decide if you're ready to adopt the change you tested. If the answer is yes, you are ready to adopt it, then your team has to talk about how the change is going to be sustained. You also want to know if you're going to want to spread this process of improvement to other parts of your agency. That may entail having more PDSAs around how to do that. But if you're ready to adopt it, you want to make sure that the whole team is on board with that, and you let the leadership know that. If the answer is no, that you're not ready to adopt the strategy that you've been using, then the team has to answer, are you going to adapt your plan and test it again? And in doing that, what you do is literally go back to the plan and say, well, in looking at this, we just realized that we need to tweak this one way of doing paperwork, and we believe that it's going to be perfect. Or it may be that you decide that you need to add an extra step that wasn't there before, or change a particular language that was being used that seems not to be effective. This is why your team may have multiple PDSA cycles within one aim or one target, is that you keep going back and perfecting this until you get it to the point that it's actually meeting that prediction, that goal that you have set. Or a second possibility is if the answer from the team was no, they're not ready to adopt it, your team is, there may be evidence that you should just abandon the plan and try another strategy. So in other words, you're not even going to keep going on this one. This one was so not successful that you're not going to spend another minute on it. And so what you do is there's two choices. One is that the aim or the target, you make that determination that for some reason you're not ready to go there yet, that you're not getting the cooperation from the leadership or from other staff to go there. It's a good aim, it's a good target, but we're just not ready to move forward on that one yet. Let's put that back on the burner for later. Or it may just simply be that you need to go back to your list of strategies that you brainstormed about ways that you might be able to meet this particular goal or target, and choose another one that that the team believes, you know, is really possible to help make that goal come true, that particular aim come true. And so that's the other possibility there, is that you can actually abandon it and go and choose something else. So after you've done your PDSAs, what do you do next? When the plan is adopted, the next step is to make sure that the strategy is trained, coached, and monitored. It's not just good enough to say we've found a successful way to do this, so then we're just going to always do this now. That's not the way we are as human beings. We tend to go back doing things the way that we were most comfortable with doing them before. So you have to have a really clear way of making sure that people are ready for this change and that there's something in place, there's a structure in place to help them make this change. This is where your quality assurance comes in. You may simply continue to use the same data that you've been collecting throughout this PDSA process, or you may choose to turn it over to a quality assurance group that'll make sure that it's being monitored in maybe already existing process that they have set up. When the plan is abandoned, a new strategy is chosen and the PDSA starts again. So we're at a point here where I want to entertain questions and also find out, and let's go ahead and do this at the same time. Go ahead and put up that other poll. And I need to know if there's folks out there, because the most important thing from any webinar, of course, is making sure you're meeting the needs of the folks that are on the other end of this. And it's really hard when I can't see you and I don't know you. And 100% I have no examples that they would like to bring up. So I have an alternative. And if you would put up the next poll, please. So I have some actual examples here that I would like to offer up to you. In the meantime, does anybody have any questions, specific questions that they would like to ask? You're not on mute from our end, so you can just unmute yourself if you do. It looks like increasing the number of fathers attending their youth individual team meetings is the highest at this point, only by one. So I'm not sure. I've got about 15 minutes left. Is that correct?
It is.
Okay. Well, let's start out with see how far we go. Let's start out with the top one and we'll see how far we can go. Maybe we can hit all of them there. So the first one that we want to talk about is a select target or aim around increasing the number of fathers attending their youth individual service team. You see that aim is really kind of broad. It's more of a goal statement. It's not an objective. It's a little more measurable, but you have a sense of what you want. What you want out of this is to have more fathers involved with these meetings. And so some of the possible PDSAs, and once again, you feel free to open up your line and go ahead and contribute to this if you'd like. But some of the possible PDSAs that I know of and that we've used, and some that I just thought of, is that one of the possible ways of doing this would be to implement a targeted flyer media campaign as an outreach strategy. So if you chose that particular strategy of trying to increase the number of fathers attending meetings, you would obviously have some groundwork to do first. You would have to have somebody that actually designed that flyer and figure out how to distribute that media campaign that would be most effective as an outreach. How is it going to best get to the fathers that you want to have at the meeting? And what you would do is, and you may recall in the earlier discussion that I had, is you want to be really clear on the steps that are involved with this. Because, you know, you can't just say we're going to do a flyer media campaign and then have no earthly idea what that means. So you want to clearly define that. Once you do that, your team, your group, will start implementing that. And they will start looking at the data. You may have the data simply be to collect the attendance sheets from each of the team meetings to see if the fathers are showing up. You know, it's really depending on where you're going with that. But that's one of the possible ones. Another possible one would be to increase the number of male peer-to-peer mentors or supports that contact fathers before meetings. Let's say that wasn't happening at all, or maybe you had mostly female peer-to-peer mentors that were doing that by contacting the fathers, or maybe nobody was contacting the fathers as a peer support. And so this is, once again, you would have to define it, exactly what this is, exactly what the steps are within this particular strategy. But once you do that, then you'll set up the way you collect data on it, and you'll monitor that data, and you'll decide what the numbers are that you want to see and how frequently you're going to come back and review the outcomes for that. And see, you know, maybe what you wanted to do is to increase the number of fathers attending by 3 at each meeting. And maybe you're getting 2 at each meeting, and really what you figured out was that you were going the wrong time of day. The peer-to-peer mentor was going at the wrong time of day to contact the fathers. So that would be a tweak. You would go back and do your PDSA again. You would tweak it and add another step in there and go back in and try it again. Another possible PDSA cycle would be to provide training and coaching of agency partners in the use of father-friendly engagement techniques. Once again, you would have to define what that means. What are father-friendly engagement techniques? It may simply be that what you're wanting to do with that is to have some language added to a brochure, or even in their verbal language, to include father language. They may be so used to speaking to mothers about their children that they forget to mention the fathers. And so it could be many different ways that you want to define this, but those would be some possible PDSAs that could potentially increase the number of fathers attending a youth service team meeting. Any comments, thoughts, or something else that you would like to add to that one? I wish I had a poll for that. Great. So this next one is a selected aim or target that improves staff's report of satisfaction in the work environment. We're not saying that they're actually satisfied, but they're reporting it in their work environment. So this, once again, a lot of times these aims or targets are chosen by leadership. Leadership may have known that they have done a survey and they see that people are not happy in their work environment. So the rapid cycle team, the PDSA team, change team would sit down and kind of brainstorm some possible ways to increase satisfaction, the report of satisfaction by their colleagues. One possible way of doing that is to reduce or eliminate an identified demotivating aspect of work, like, for instance, carrying a cell phone every evening. We do have people that do that, and you may be the very ones out there doing that. Or eliminating duplicative paperwork. Those are kinds of things that people get really, really tired of having to do, and while they may love their job and they may love the folks that they work with or the work that they do within the system of care, those kinds of things really wear on people and cause people to start looking for other jobs. Another possible one would be to implement a cross-training program teaching others to complete intakes, as an example, to ensure extra staff support is in place when needed. So let's say that there comes a time where there's a lot of intakes every Thursday, and people just get swamped. They just get swamped, and everybody gets frustrated with them because they can't get people in for the intakes, and people are waiting in the waiting room too long, and the people who are doing them are staying late, trying to catch up. This is one way that you could help kind of ease that bottleneck by doing some cross-training so that extra staff can kind of step up and maybe do a job that they don't usually do but are capable of doing. Another thing is to provide a strength-based feedback to staff regarding their performance. We all like to hear when we're doing something right. And while these are rapid cycle tests, and once again, you don't want them to go on for months and months and months, you could set up a time frame in which all supervisors would provide, with a framework, some kind of feedback that's helpful, strength-based to each of their staff. And then later on down the line, in a week or two, do a survey about how the staff perceive that. And that could actually help move you in the direction of more things that you could do to help with staff satisfaction. Any comments, questions? I think I have time to move on, don't I, Cora?
Yeah, we've got about 5 minutes.
Yay! Okay, I'm going to get through them. Yay! So this next one is a target or an aim that's to reduce the time from a completed screening to a completed assessment. We all know, I'm a clinical person too, we all know that there is a time lag at times between getting a screening done and getting somebody referred to actually having a completed assessment back in your hands. So one of the possible PDSAs that your change team could address, and they may have brainstormed and came up with this, is that they're going to try to synchronize the movement of the referral process between two agencies. In other words, they're kind of out of sync the way that one system operates into another system. It may just be simply that, the referral for assessments happens on a particular day, or that in order to get an assessment done ASAP really quickly for a quick turnaround because it's an emergency, that there's a certain person that you need to contact that the other agency didn't know, the secret handshake of. It's all of those kinds of things that you would line up the steps for it and test and gather your data and see if it's making any changes, any improvements. And once again, tweak it if it looks like it's working, or if nobody's getting in for assessments by changing it, you want to stop it and go back to the beginning and do it again. Choose something else. One of the other things that you can choose is to utilize a walk-in clinic model for those who have a positive screen. So let's say another agency is doing a screening and you want to have people get assessed, there can be a process set up so that particular folks who have a positive screen can go on a particular day during a walk-in clinic and be guaranteed to be seen that day. It's a pretty simple way of doing it. May work, may not work, may have to tweak it in order to get it to work. But it's a very clean kind of strategy that you can do that you'll know if you're getting people screened quicker, assessed quicker, that this particular PDSA cycle actually did help with that. And finally on this one, there's the possibility of providing an on-site qualified staff person to perform assessments in a partner agency. So instead of somebody having to leave one building, maybe travel across town, maybe even to another county or another part of the state to get an assessment, your test would be, I wonder if on the day they're doing assessment screenings, if we had a person there in the afternoon to do assessments, if we could get more completed in a quicker time. And once again, you would test that out. And finally, this one is a target or an aim that could be selected by leadership that looks at increasing the attendance of team members at planning meetings. So you have either the individual service team plans, you may have regional councils, interagency councils, you may have fellowship teams, that you have to have members that members are starting to dwindle. And so you want to do some PDSAs around that. And one might be a very simple thing of using a reminder system. Maybe you've never reminded people, and they can help you set up, what would be the best reminder for them. Send me a text day before, send me a letter on Mondays, and then, have somebody stop by and pick me up in a limo. Whatever it is that y'all want to set up as far as how to describe the steps in that particular one as a strategy, that's what you would implement and measure and discuss and tweak and decide whether or not you want to adopt, adapt, or abandon. Another possibility would be to coordinate the timing of meetings to reduce the time spent away from their other duties. So in other words, we all have multiple meetings that we go to, and sometimes we spend so much time in meetings we're not able to get anything done that we are supposed to do and get assigned in meetings. So coordinating the timing of meetings can really help with increasing the attendance. It may be that what you decide to do is that you have several meetings where there's an overlap of membership, and so you all get together and you choose, let's have that meeting, these 3 meetings, every Thursday, the first Thursday of the month. And you test that out and see if you're actually getting better attendance because you're having the meetings all on the same day. Another possibility would be to provide success reports to the supervisors or leadership of the team members. Sometimes what happens, I think, a lot with team members is that they're the doers. They're the people that get stopped in the hallway asking for this or that, or can you help me with this? And we have very committed folks working with kids and families, and so nobody ever says no. So occasionally to provide a report about the success that these team members are having back to their supervisors could actually give them more support and maybe free up a little bit more time in order for them to attend these meetings that are obviously being successful because you're sending information about that. And that's something that you would test and gather data on, and once again, take through the PDSA. And the final one with this is to provide a member attendance sheet to supervisors and leadership. And this attendance sheet, while it may seem a little bit punitive, it has actually turned out, we've used it in Kentucky with a group, and it's actually turned out to be a really positive thing because what happened was when One particular agency was seeing that their membership was not showing up at these meetings. They had a conversation because it wasn't just one person, it was across the state. And so they had a conversation with their employees, with the people that actually do this work, and found out that there were some really significant barriers in their system that were keeping them from being an active participant within these team meetings. And they were able to eliminate those. So sometimes, just that particular thing of doing a PDSA on providing attendance sheets, you could actually come up with some pretty amazing positive outcomes from that. The other thing is you could have some unintended consequences and people could get in trouble. So that's why you want to have the right people sitting at the table in your team that could help kind of walk that through for you. So I think those are the 4 examples that I had for those. And Cora, is there anything else here that I need to be looking at?
No, I think this was great, Carrie. Thank you.
We're good? We're good? Okay, so here's a slide that just helps you see Reclaiming Futures if you're not a part of Reclaiming Futures. And please visit Reclaiming Futures online. It's got a wealth of information. And like I said, I work in system of care and in Reclaiming Futures. And they really are a nice hand-in-hand interagency collaboration that really can make a huge difference in a positive way for the families and the youth that we serve. And there's my contact information. So, Cora, you have anything else you want to add?
I don't, but I hope that this was helpful for everyone that's looking at ways to approach their quality improvement and that you've got a much better understanding of how to use the Plan, Do, Study, Act model.
Yes, and please feel free to contact me. There's my email address if you have any questions. I'm happy to correspond with you, and we can talk if we need to on the phone. I'm happy to do that. Thank you all.
Thanks, Carrie.